438 from the University of Ottawa. Thank you again for joining us this afternoon, and I hope you're well.
Oh, thank you so much. You as well.
This is one of those situations where several weeks ago you said to us that in wave 4, this is going to rip through the unvaccinated. And are we seeing that not just in Manitoba, but worldwide?
100% that's what we're seeing. Now, with a little caveat, there might be some protection for the recovered. Immunity from infection does exist. It might not be as robust or as long-lasting or as predictable as immunity from vaccination, but it is a factor we have to consider. But definitely, in Canada, we have so few infections compared to the rest of the world that we don't have the same amount of natural immunity built in. So we really have to focus on vaccination. And if you haven't got a shot yet, I encourage you, please do so.
Saskatchewan extending its COVID-19 public health order until the end of January. That province's premier says the mask mandate will remain in place, as well as the province's vaccine passport system.
If everyone continues to be diligent, continues to exercise a degree of caution, and continues to go out and get vaccinated, we should be able to get together safely over the holiday season without increasing the spread of COVID-19. But it does take that extra effort, the effort that we have all been giving for the last number of weeks.
That's in Saskatchewan. Ray Watt, safely get together over the holiday season. What do you anticipate that will mean?
Well, magical things can happen for fully vaccinated people. Your risk of convening indoors together without masks is actually quite low if the community transmission isn't entirely untoward. It's when you start mixing the vaccinated and unvaccinated people that the risks tend to go up. So people with children who aren't vaccinated yet need to take some extra precautions. And if you're a little bit concerned about the vaccination status of people present, really focus on ventilation and focus on mask wearing. And also, if you've got symptoms of any kind, stay home, isolate. That's one of the best ways to reduce transmission, is to keep the symptomatic from intermingling with non-symptomatic people.
And get tested, because we are hearing that some people are not only vaccine hesitant, they're testing hesitant, and that's a problem.
Oh, yeah. Actually, I never considered that as being a major issue, but it probably is.
It is, yeah.
Yeah, and testing is uncomfortable. I've been tested. Many of us have been. It's not fun, but it prevents long-term suffering for a lot of people and possibly death. So it's a small price to pay for an amazing impact.
And we get that information from health officials who are saying they're finding out that people are getting their first test and getting word that they're positive when they're being admitted to hospital. We spoke yesterday with someone who you're very familiar with Jason Kinderchuk from the University of Manitoba, and we're talking a little bit about the vaccine rollout among children between the ages of 5 and 11. That really began in earnest today in Winnipeg at the super sites. And I mentioned a statistic, and I knew I'd seen it somewhere from a reliable source. Scrolled back, sure enough, it was from you, and you had quoted it on Twitter. I misspoke. I thought it was for the younger 5 to 11 age group, but in fact, it was for those 12 to 17 from the United States. The numbers are very good when we're looking at almost 9 million American children, 12 to 17, getting the vaccine. What was that statistic when it talked about adverse events and safety?
Well, we're looking at 1 in 1,000 suffer some kind of adverse reaction. Now, that can be anything from a fever to pain. The serious stuff is much rarer, and the stuff that people are quite terrified of, the myocarditis, the heart stuff, I think they recorded about 800 cases of those out of 9 million. So that's a very tiny proportion. And while some kids did die, none of those deaths have yet been linked to the vaccine. So we have to be honest and transparent with these risks. I mean, there are some risks, but the risks are vanishingly rare, and it's unclear if those risks are actually linked to the vaccine yet. So the data is still evolving.
Isn't that what you do by crunching the numbers, looking at that risk-reward situation?
Yeah, that is much of what population epidemiology is. The way that vaccine surveillance works is people report likely connections between getting a vaccine and getting some adverse reaction. And when I say likely, hey, I had this thing happen to me 2 weeks after the vaccine shot, then someone has to investigate to make sure that it makes sense that they were actually linked. It wasn't coincidental. Very often, some of this data is just reported without that investigation. So you see these inflated correlations, and that terrifies people. You got to wait until the people actually investigate and figure out if it makes sense that there's a link.
This is the president of the European Commission.
Vaccination against COVID-19 saves thousands of lives in the European Union. But a new wave is hitting us, and we need to step up vaccination further.
What's going on in Europe?
Wow, yeah, Europe. And some countries like Austria and Germany are in real crisis. Their vaccine uptake has not been good for a variety of reasons. Much of it have to do with the spread of misinformation from certain political quarters. And as a result, they're seeing an incredible rise in cases. That's married to things being open, markets being open, people not sticking to the mask mandates and so forth. And they're in crisis, and they're seeing the worst of this pandemic so far. The Austrian numbers are just terrifying. On the other end, you've got places like Spain that's looking relatively well compared to the rest of Europe, very high vaccine uptake. So it comes down to vaccination rate and vaccination distribution. That matters also. We can't be clustering the unvaccinated.
Ray Watt, we always appreciate your time. Thanks so very much for popping on with us.
Thank you very much.
Ray Watt Deonandan from the University of Ottawa.